Good afternoon and welcome to today's SpectraCell's Discovery Hour, where we will be discussing sports nutrition and energy optimization, presented by Dr. James Cordoba. My name is Javier Sandoval. I'm the National Sales Manager for SpectraCell Laboratories. Before we get started, let me just tell you a little bit about our laboratory for those of you that are not familiar. We were established back in 1993, so we are the industry leader when it comes to the type of unique and sophisticated tests that we've been offering for the past 30 plus years. We're based in Houston, Texas, which is home to the Texas Center, which is world renowned, which gives us access to unique technologies and specialists and other industry experts to help us develop the tests that we offer today. I like to consider us a boutique laboratory because we do specialize in personalized disease prevention and management solutions with state-of-the-art technology that is patented that no one else has access to offer like we do here at SpectraCell Laboratories. We are a CLIA certified lab. We've tested well over 1.2 million patients in the last 30 years, which gives us an enormous database of the samples that we have. We've got global relationships in 14 countries besides the United States, in Canada, throughout the Caribbean, Central and South America, throughout Europe. In fact, our furthest accounts are in Dubai and Israel, and we're currently in the process of opening up our Asian Pacific market as well. But enough about that. Let me introduce you to our speaker today. Dr. Cordoba is a doctor of chiropractic medicine. He's been practicing almost 2 decades, where he received his degree from the Texas Chiropractic College in 2006. He's the owner of Chiropractic Sports and Acupuncture for the past 14 years in Austin, Texas, specializing in functional medicine, chiropractic and non-surgical spinal decompression, non-traumatic repetitive type sports industries, and rehabilitative strengthening protocols. Dr. Cordoba, at 60 years old, still runs 30 miles. An avid weightlifter, practices a carnivore type diet for the past 2 years, having practiced nutritional ketosis for the past 10 years. He works with families also that have autistic children. So Dr. Cordoba is a very unique individual in terms of having to go over the sports nutrition and energy optimization of SpectraCell's various tests. And we appreciate his time and effort into this webinar. So for those of you, just sit back and relax. No need to take notes. We will share the recording on the slides with you at the conclusion of today's presentation. So with that being said, I'll hand it over to Dr. James Cordoba.
SpectraCell Laboratories and micronutrient testing regarding the role of sports medicine. I want to definitely make sure that the purpose of our discussion today is going to focus more on the rule as opposed to the exceptions of the rule. And I find that when we are talking with the vast amount of opinions based on nutrition from both sides, allopathic and on the functional side, that sometimes I find that we begin to get bogged down with giving exceptions. So I want to focus more on the rule as opposed to exceptions. We can always find a marathon runner, for example, who might be a diabetic. It's very rare and it's uncommon. So I just want to make that point. The role of sports medicine, injury prevention, performance enhancement, targeted care, rehabilitation, and holistic health. Prevention is always the key, has always been the key in my office, and I believe that it needs to be the primary focus when we're talking about helping our patients in resolving the issues that the health issues that they're dealing with. The CDC, for example, the leading causes of death from 1 through 10 begin with heart disease, cancer, inatrogenic type of accidents, COVID, stroke, respiratory disease, diabetes, Alzheimer's disease, kidney and liver. Any one of those on the top 10 are going to be preventable. So in establishing micronutrient testing in your office really gives you a vast amount of information just in that criteria of prevention. Performance enhancement, of course, once you are looking at micronutrient testing, and you'll be able to see the deficiencies that the patient is dealing with, it'll give you much more of a targeted care in that most of the patients that are coming into your office are taking some sort of supplementation and simply don't know why, right? They've heard things that they should be taking. They'll go to their nearby vitamin box or CVS or anything off of grocery stores, or Amazon, right? And they're buying, of course, the most bought or purchased type of supplements. And of course, we know that simply just throwing supplementation can cause imbalances within the system and can actually hurt the patient more than help the patient. And of course, our patients don't know this, or at least the ones coming into my office don't know this. So the micronutrient testing, in my experience, provides a very targeted point of care for the patients that we're simply not guessing. Um, Performance enhancement, anytime patients are walking in, whether it's your weekend warriors or, guys that are coming in their 40s that have collegiate sports in their background, these patients may be much more attuned to how they're performing in their everyday lives at the job, whatnot. However, performance enhancement, really performance just in general, patients dealing with their everyday activities of daily living, the stresses that they deal with their lives, are, in my opinion, you don't have to be an athlete in order to benefit from micronutrient testing. The rehabilitation side of things, yes, with micronutrients, you are going to give the patients, depending on their deficiencies, the precursors, the building blocks, actually, that are going to help them to, perform better, for better muscle contraction, for better stamina, for better resiliency to stress being physical and also mental. And I think that in dealing with performance enhancement, it needs to be not just a physical level, but also, in a mental or a cognitive basis as well. The stresses that people are dealing with, whether it's relationship stress, whether it's loss, whether it's loneliness. These can all come to play as far as, in my opinion, performance enhancement. So it doesn't have to necessarily be just an athlete that is coming in which micronutrient testing will benefit the patient. And of course, in holistic health, that's essentially the way my office has worked. I work very comprehensive as a chiropractic. I've been involved in functional medicine for over a decade, and I find that when you offer the patient the idea of prevention and performance and, this comprehensive holistic type of health, it prevents, these common diseases that we are seeing as far as in the United States for mortality, which we know that all of these can be prevented. Um, so let's move on. Know your body and optimize your health performance. The difference between good and bad micronutrients. Now, some of the things that I may say may be controversial for some. My diet is, I do not have I would not say that someone looking at my diet would say that I am well balanced. I'm primarily fat and protein. I've been that way. I've focused my diet, my dietary habits for the past 2 years in that way. I've been keto for probably, at least since 2015, with restrictive carb. Now I probably do maybe 10 grams of carb per day, with, again, primarily fats and protein. That is not the way I was taught in school. That is not what I see from the allopathic side of medicine as well. It is always, patients trying to eat the rainbow, or eat, a variety of foods, or doing the Mediterranean type of diet, a little bit of rice here and there, a little bit of beans and lentils. The problem that I keep seeing with this type of mindset is that most people just simply can't eat that way, at least not consistently. And so I do a lot of biohacking with my own health, and I have found that that eating a primarily fat, high protein diet that my health has been the best that it ever has at my age, and I would consider myself old at 60. I don't necessarily tell that to my patients. I don't really consider old age really until about 80, in their 80s, maybe. I see a lot of patients in their 40s, and they think that just because they can be on one foot putting on their tennis shoe, that they're just the epitome of health. And I don't feel that that's necessarily a good marker. So diet is very, very important. I always, make sure that my patients understand that I'm going to be directed where the dietary choices are going to supplement the supplements that I'm going to prescribe, and vice versa. Patients have to be aware of the food that they can choose in order to help with the deficiencies that we're going to find on micronutrient testing. And if they don't, I think that it's more of a one-sided type of direction, which is not as optimal as both food and supplementation. And of course, we all know that we are mainly going to absorb hopefully more from our food than we would with supplementation. So diet is going to be an ultimate, is going to be a big factor for me in working with patients. I do work with families with children on the spectrum. I myself have a child on the spectrum, and her diet is impeccable. She probably eats I eat exactly what she does. Again, she's probably doing 10 grams of carb a day, and those are coming from berries and some kefir. So blue, black, strawberry, black. Those are really the berries that we're doing, and that's really all the fruit that I will, or the carbohydrate that I will allow her to eat. She does really well. Her blood exams are very good. Her kidneys are functioning fine. Her GFR is fine, so I do make sure that I handle blood work with my patients, and of course with her as well. I will not work with families that are, that are having children on the spectrum if they will not adhere to my dietary plans. So I don't find that any amount of carbohydrates, depending on the child is dealing with. I don't find that any amount of carbohydrates are really necessary. But again, I will point them towards those berries. But if you allow people to just have this idea that they can eat any and all types of fruit, being that most of the children coming in are dealing with weight. I've had a child that was at least 125 pounds overweight. He came in at probably 225. These are all going to be weight gain, and insulin and chronic insulin are going to be factors that are going to lead towards ill health, and lead towards poor performance, leads towards in these children, and also us as well. But I mentioned the kids on the children on the autistic spectrum, because they are at a more of a heightened level than what we would necessarily be. They're very much affected, and my daughter as well is very affected by any excess carbohydrate that she might receive, which we're pretty good with. So again, the diet is very, very important. Why are we biochemically unique? Just age, lifestyle, intensity, and physical training. It's very, very true. I'm not going to have somebody that is running a 10K every day and try to restrict them towards 10 grams of carb per day. I don't necessarily run in that way, but if somebody was running in that way, yes, they're going to have some more carbohydrates coming into the system. But if you read guys like Mark Session, The Primal Diet, he's written a very good author, very well referenced guy when he writes. He was a marathon runner, a competitive marathon runner, and an athlete. And even the carb, because I've done the carbo loading myself, and he describes his experience with carbo loading to where it simply caused inflammation of the joint and of the joints. And it's also, of course, going to keep increasing the chronic level of insulin that we have coming into the blood. And everything that I am studying, most, and we can talk about this later, of course, as well, that most or many of the cognitive disorders that we're dealing with, children on the spectrum, Alzheimer's disease, Parkinson's, any early dementia, are going to be associated, cancers are going to be associated with chronic high insulin levels in the blood. So, I've always taught myself to kind of treat myself as if I am diabetic, and I find that it has been very, very beneficial. Of course, prescription drugs with patients coming in, everybody seems to be on something, so that's always going to will cause poor absorption issues with certain micronutrients, and that micronutrient test will just give you really great information on how to direct your patients on in helping them resolve the issues that they're coming in with. Um, of course, the role of sports nutrition, the lipoprotein particle profile, I think is very important. I find that patients tend to be they're trained from the allopathic side of medicine to be very concerned with their cholesterol. I am not concerned with my cholesterol. My cholesterol is through the roof. I'm probably about 224. My LDL is probably 163. However, my triglycerides are probably 51. My A1C is probably 5.1. So those are the markers that I'm really going to do, that I'm really going to look at as far as trying to see where I am on a cardiovascular risk level. So I'm sure that if I went into any doctor's office, any MD's office here, that they would, of course, do these blood exams and immediately want to try to put me on a statin drug. I no more need to be on a statin drug at all. My risk for cardiovascular disease is probably almost zero. But yet I still continue to have patients coming in, usually men in their 40s, usually men that have athletic backgrounds will come in and speak about why they seem to be losing their math that they once used to have, or if they're engineers, they just seem to have lost the edge. And so in asking them, in histories, what is it that you've changed? Most of them, in my professional experience, have always claimed, well, I went to the GP for my annual exam, and the MD put me on a statin drug. So the lipoprotein particle profile is going to give you the information on what the cholesterol is looking like. Is it dense? Is it fluffy? And that'll give you a better idea of the health of the cholesterol. We all have to have cholesterol. Cholesterol is a precursor to vitamin D. Cholesterol is the precursor to select steroids. Testosterone being the number one. That's the number one thing. Issue that I see coming in is men in their 40s or 39. It starts at about 39, anywhere from 39 to 42. They're already not performing in the bedroom the way they used to. They're seeing fatigue. They don't seem to have the stamina that they have, and and they are on sometimes low fat diets, low salt diets, and they're on statin drugs. I don't understand the mechanism or the rationale between where the body has to have cholesterol. The body is making 60 to 70% cholesterol, and yet the rationale is to lower your cholesterol because you are at a cardiovascular risk. I believe inflammation is the cardiovascular risk, and that's why I point to triglycerides and A1C, and those are the real markers for me. Of course, and again, they are exceptions where you're coming in, where patients may be coming in a little bit overweight, and then of course, keeping them on a statin drug may be where they need to be. I just find that I struggle with the cholesterol, and I think everybody has their opinions and their studies concerning cholesterol. I think every person can give their opinion on cholesterol. The bottom line is what is working. And I don't see lowering cholesterol as being advantageous to the patient at all, especially as the patient ages. And in my office, that is very much the focus. Is a lot of the patients that are coming in, they're not necessarily worried about their health at 40 years old. They're not symptomatic necessarily at 40 years old. Symptoms begin I find in my practice at about 39 to 40 years old. For women, it's different. The women are going through different hormonal changes, from the time that they're adolescents. In my opinion, they're a little bit more complicated. So, their level of health, I think, is much more demanding, if you will. But my focus is always, if we don't address the micronutrient deficiencies that you may be dealing with, you're gonna be setting yourself up or increasing your risk for some of these major diseases in the future as you get older. MTHFR genotyping, very important. In how genes are, and homocysteine levels as well. Now on genes, GENES, right? I find that, for example, BRCA1 and BRCA2, both men and women both have those genes. This is the gene that is promoting cancer proliferation in the breast. And the idea is that we all have these genes. So why is it that some seem to be triggered and some are not? And I would go back to exercise, dietary choices, SAD, right? Standard American diets, which are horrible. The chronic insulin in the blood. Those are factors that will or may trigger gene mutation, and thereby starting this proliferation of cancer, which of course we all want to get away from. Cancer is it's a development, in my opinion, from everything that I have studied. It's not a 1 day, 1 week. My mother died from pancreatic cancer. Everything that I've read, that's a 10 to 12 year development of cancer. So micronutrient testing or these tests that are provided are very, very important for the patient, and I highly recommend them. Let's move on. So sports nutrition, these biomarkers here you will see on the micronutrient test. And I just want to mention on the fat-soluble vitamins, I mentioned this because, again, we're seeing a lot of patients on this fat. They don't think they should be eating fat because, of course, it's going to cause heart disease, or they're away from meat because they think that it's going to increase inflammation or cause cancer. I do have a study, the effects of total red meat intake on glycemic control and inflammatory markers. I can put that at the end of the presentation if somebody is interested. And this is actually saying that total red meat consumption for up to 16 weeks does not affect changes in biomarkers in glycemic control or inflammation for adults. So this idea that I can't, the reason that I'm speaking about this is because I'm constantly hit from patients, or patients are commenting or push back on some of my dietary recommendations, and the fact that they think that red meat or meat derived products are going to increase their cancer. That is not true. Or increase gout. That is not true. I eat nothing but meat, but fat and protein, and I'm not suffering from any of those issues at all. And you can find many people that are practicing the same type of dietary restrictions that I am, and blood exams look good, and everybody is in really good health. But going back to sports nutrition, on the fat soluble vitamins, I have found that, for example, if we're looking at vitamin E specifically, right, an antioxidant, and you're going to get an antioxidant marker on the micronutrient test. And so there are many antioxidants, vitamin E being one, fat soluble vitamin DAKE. And I have always learned that 2 tablespoons of olive oil every day. That's the medicine that you take. It's a good monosaturated fats, good lipoic acid, and it's a good liver detox as well. And so when my patients are taking their supplementation, I always recommend, for optimal absorption, right? It's always about what we're absorbing, right? And that's going to depend on what patients are dealing with, if they're having gut biome issues, if they've had colon resections, if they have any kind of biases towards meat, right? If they're vegan or vegetarian, that's always going to cause an issue with absorption of fat soluble vitamins. So even I had a patient, and just looking at their vitamin E as far as their antioxidants, and just implementing the olive oil, and of course I always include butter in there. They need to be eating butter. That I On the second exam that I took with this patient, micronutrient test, their vitamin E levels or their fat soluble vitamins all had increased without even necessarily addressing those deficiencies. Now they weren't deficient to begin with. However, on the second micronutrient test, without even addressing or supplementing or prescribing vitamin E, his fat soluble vitamins were actually increasing by just simply putting in more fat into his diet. And so the patient was it was astonished. Essentially, he has had colon cancer. He has resection. So he was underneath this idea, of course, always fruits and vegetables, and and low fat. And so I turned him away from that, and just said, just try it. Sometimes you have to gain trust from your patients, and what'll work. And I think that's an important thing to note with supplementation, is that you want to make sure that dietary habits are consistent and that they're on the right direction. I don't find that veganism, and there's a great book, it is referred to as Vegetarian Myth. It's by, the last name is Keith, Keith. Really good book that I hand out sometimes with my patients that give me a lot of pushback, especially from the families with children on the autism spectrum, that will help with the idea of, I think the idea of what all vegetarian or vegan type of lifestyle will do as you start aging. One of the biggest ones, of course, is poor digestion. They no longer make any acid in their stomachs, which they're not going to absorb minerals. It changes their gut biome, and they start having a hard time of it. Not in the beginning, but as they start getting into their 40s and 50s, I see more and more patients that have this type of diet, and it affects their health poorly. You can even go online and find people that talk about being vegan, and finally just getting so sick they're having to change what their bias towards this stuff, and they get better. That I want to mention as far as what we're looking at as far as sports nutrition. And again, not necessarily just sports nutrition, just overall comprehensive good health, good optimal health to begin with. Let's move on. Overview of micronutrient testing. So, and the one thing as far as the differences between micronutrient testing, which is more of a cellular, it's going to determine more cellular health, as opposed to serum blood testing, which is really just a snapshot of what is in the blood at the time. It is not going any deeper than that. So those little exams, annual exams or blood exams that doctors will ask for, are very suboptimal. They really don't give you. I mean, it's okay to do as far as giving you a benchmark, but a micronutrient test at a lymphocytic level is much more precise on their deficiencies, on their micronutrient deficiencies that you're going to find, and also to how it's going to relate or be associated to the symptoms that they're coming in with, whether it's chronic fatigue, whether it's restless leg syndrome, whether it's tinnitus, whether it's I'm always sick all the time, whether it's irritability, things of this nature. So the micronutrient test, in that way, there's no getting around the problems that the patient may be having. Also, too, the micronutrient test is going to go back. It's going to actually find cellular health anywhere from 3 to 4 to 5 months in the past. So it's almost like it's a more optimal test, just the way an A1C biomarker would be a much better test, or a C-peptide would be a much better, or fasting insulin would be much better, optimally for the patient's glucose metabolism versus a fasting uh, glucose number. I believe that the top of that number is 99, although I'm seeing reference ranges changing now to almost 120. So it used to be 99, but I have had a couple of patients come in with those reference ranges being at 120. And the other issue that you're dealing with as far as reference ranges is that, I find that patients that will come in and they'll say, well, my metabolism is absolutely, you have patients that are 50 pounds overweight. They'll bring me exams, they're fasting glucose, whatnot. And, they're at a 98 and the reference range is at a 99, and they think that they are healthy. So there's a lot of education that the micronutrient testing will offer your patients as far as, you know, what type of test is really giving them the information that they need and that they're going to benefit from. And serum type of testing, I do blood labs in my office, and there's certain ones that I do. There's a list of them, but the markers are not simply what the normal MD is going to prescribe. I think that they don't offer enough. So, in the micronutrient type of test, this is you're going into cellular health more so than just what is in the blood at that particular time. Okay, you can take a blood exam in the morning versus in the afternoon. That's going to change. That's going to fluctuate your biomarkers. If you're on certain medications like statin drugs, that may increase liver enzymes. Medications may prevent certain mechanisms that micronutrients precursors are working towards. And so there's a lot of different age, of course, is going to be will influence biomarkers in serum type testing. So I've always found that my best that my most critical information is going to come from micronutrient testing. Let's move forward. How is it measured? The it's micronutrient testing is testing lymphocytes. Why work with lymphocytes? Because there's a more proliferation of lymphocytes, and they are nucleated, so they have a nucleus, which is where the opposite would be a non-nucleated, would just be simply be micronutrient testing that is testing red blood cell that is non-nucleated. As you know, and so the lymphocyte testing cell gives us a better idea of the cellular health that a patient may or may not have. That's why the T cells are so important here. Why do micronutrient test units differ? Again, in the SpectraCell, if we can look at routine labs and non-functional testing, vitamin D, B12, magnesium, those are usually what the doctors will hone in on, as opposed to the 31, 32 markers that you're going to find in your micronutrient test. And those, routine lab vitamin D, B12, and magnesium biomarkers are very influenced, and they're only of what is in the blood at that particular time. I always find it very interesting when patients, spend their money on B12 shots or comprehensive vitamins, that they're getting from wherever, and they think that they're actually doing something. They don't realize that it's really optimal health is going to be from the absorption from these micronutrients at a cellular level, and not just in the blood. And whatever that they may be absorbing from the blood is, in my opinion, from my professional experience, is not going to be optimal, as opposed to absorbing it through their food, absorbing it through a good, reputable supplement. That's the other issue, that once you start, when you start performing these micronutrient tests, if you are not using reputable micronutrients or supplements, you're not going to really get the results that you want to get. So, there is no regulation, regarding supplementation and how that they're made. If you look at a documentary called Bigger, Stronger, Faster, I believe there's a little there's a little blip in there of how, guys are actually making supplements in their garage. They're putting a pretty label on it, and it's basically just a capsule with rice flour. So, patients will bring this to my attention as if, they got it from Amazon or Cisco. Here I'm taking my vitamin C. Here's my 500 cap bottle that I bought from Cisco. And so that kind of stuff, as you well know, is just junk. So that's the reason sometimes patients will say, "Oh, I do all that supplement stuff and they don't help," and it's because they're just not taking a reputable supplement from a reputable company. So I'm pretty sure all you guys have reputable companies that you work with. Whereas if I go on the SpectraCell side of things and looking at vitamin B, B12, and magnesium, those numbers that I'm finding at the lymphocytic cellular level, I know I have much more confidence in than I ever would with routine labs.
Thank you for joining us today. We appreciate Dr. Cordoba and his insightful information regarding sports nutrition and energy optimization. Just to recap, here are the tests that were mentioned during this presentation, and you can visit, for those of you that are consumers of SpectraCell, you can go to our website, which is shop.spectracell.com. We talked about micronutrient testing, our LPP test, that is our lipid protein particle profile, the MTHFR, and our energy optimization wellness panel. You can utilize the code of sports10, which will give you 10% off any of these tests, and that will be good through the end of the month. And for those providers that are wanting to take advantage of the sports 10 discount as well, just write that on the requisition form in the special instructions section of those requisitions when you send in the samples for your patients. Again, this is Javier Sandoval from SpectraCell Laboratories in Houston, Texas. We appreciate your participation, and everyone have a great day. Bye-bye.